great deal of concern, as most pediatricians are saying. Ben, today spoke to Dr. Thomas Murray here. He's part of one of two children's hospitals in Connecticut. Of course, Yale New Haven Health has one of them. And what he said today was they're not certain whether or not the Delta variant actually makes kids sicker or not.
Certainly the number of kids we've admitted in the last few weeks, again, not knowing for sure if they have the Delta variant, some of them have been quite sick and required intensive care unit.
But as of this morning, only one child was being treated for COVID in Yale's Children's Hospital.
Fortunately, COVID has spared children for the most part, and that they tend not to get as sick as adults, and that has held true through the summer.
Across the country, there were 72,000 new COVID cases among kids last week. The week before, 39,000, which is an 84% jump in 1 week.
If one person with the Delta variant exposes a bunch of people, the number of people that will get COVID from that person is much higher than it was for the original strain.
During July, 4.2 million kids tested positive for COVID, which accounts for about 1/5 of our nation's total for the month. Some 60,000 folks under the age of 20 here in Connecticut have tested positive for COVID since the pandemic first pounced. And Dr. Murray says the vaccines speak for themselves.
No child who's been admitted for COVID has been a vaccinated child. I do think COVID is going to be with us certainly through the winter and into next spring.
Now, the doctor also said that his predictions are not often very good, and there was a light moment when he chuckled there. Out of the 8,300 COVID-associated deaths we've had in Connecticut since the beginning of the pandemic, 4 have been folks under the age of 20. We're live in New Haven. Tony Terzi, Fox 61 News.
Tony, thanks.